So good evening, everybody. My first learning about MITSS actually just happened a year ago, and I came to this event because my predecessor had come to this event, and he had bought a ticket. I didn't know anything about MITSS and what they did and who did it, but I guess I thought it'd be a good networking thing to do. And so I came, and I have to say I was just absolutely struck by the enthusiasm and the excitement and the mission that is MITSS, kind of like you're all experiencing here tonight. So when I got back to my office the next week, I called Linda, and I told her that, and wherever she went to there, and no, that's all right. And she said, "Well, let me come over and meet with you," and she did, and she told me her story, and I'm sure many of you have heard her story. And it's quite a story about her own personal experience and how she founded this organization, and you could feel her passion and her commitment, and really feel the importance that she brings to this endeavor. And I said, you know, I'd like to get more involved. And she said, how would you like to co-chair the dinner? And if Linda's ever asked you to do anything, you know it's hard to say no. But I did say, let me think about it. And I talked to Dale Lodge and a couple of other people. Dale had done it the year before. And the more I thought about it, the more I thought, you know, this would be a really good thing. So I agreed to do it. And over this past years, I've worked with Linda and Winnie and others on the leadership committee, and have experienced more closely, again, the commitment and the mission and how strongly the folks involved feel about this organization and what they do. You can't help but have that, grow on you, and it has grown on me. And I guess one of the things I want to say is, as we, in this state and nationally, as we re-engineer our healthcare system, I certainly hope, and I'm sure you all hope, that we re-engineer in more of the things that MITSS stands for, dignity and respect for our patients, for their families, and for our caregivers. That would be my hope for this evening. So I, too, would like to thank my co-chairs, Luke and Trish. It's been a joy working with you both. The Leadership Committee, which is sprinkled throughout here for all of your hard work and your arm twisting and all the rest. It's tough work, but we did it, and we got a great crowd here tonight. And then, of course, to Linda and Winnie and your staff for all of your hard work. But most importantly, to all of you for being here and showing your commitment to the wonderful mission of this organization. Thank you very much.